Welcome to Explaining Pain. As of right now, it seems like it's a short list of folks who are on board, but we'll see if it expands out. At least now I can get the intro done and people can come on as they like. So the purpose of this webinar is to kind of talk a little bit about pain, what it is and what it means. This is based on the book Explain Pain by David S. Butler and G. Lorimer Mosley, both of whom are neurologists and pain scientists. And who've been studying this thing rather deeply. This is an evidence-based approach to pain management, and I plan on not talking about any of that evidence except in the broadest of terms. My goal here is to not get into the weeds. It's to give you as grounded and concise and embodied an understanding of what's going on with your body as you can, or rather as I can. My name's Peter. I'm a doctor of chiropractic. I'm a registered massage therapist. I've been practicing in healthcare in some form since 2005. I have a special interest in chronic pain and athletic populations, and so most of my practice is composed of those people. Everyone from like the day-to-day person who has chronic pain to the athlete who's trying to get to the next place. And pretty much everything that we talk about here, I will use in some way, shape, or form with my patient base to try to make them better. So what I hope that we'll get out of today is I want us to get a real sense of what pain is. I want to get us a real sense of what pain means. And I want us to get a good sense of how to manage it effectively. And I think we're going to start with understanding and kind of work our way along. So pain fundamentally is our threat detection system. It's designed to call the nervous system's undivided attention to threats. So in doing this, it has a couple of ways that it can respond. It's unpleasant in its nature, and that unpleasantness helps drive the behavioral change that pain is adapted to have. So, hi Shirley, welcome. So it's there to alter your movement. It's there to communicate that you might need to think differently about the part of you that you're encountering. And it's there to change your behavior. It is a danger signal. So it's going to activate with response to perceived danger, but it won't activate if it doesn't perceive any danger. And this can be really frustrating. Like we have bodily conditions that don't create pain that are still very dangerous to us. I think lung cancer is a super classic example where people don't have pain from their lung cancer until it's reached stage 4. And by then it's usually very difficult to treat. Whereas if we had managed to find it in stage 1, it wouldn't have been. So it isn't perfect by any means, but it does tell you when your brain is cognizant that danger is there. In many ways, pain is the light on the top of a Christmas tree. Like, it is the bright thing, it is the center of your attention when it is on. But there's actually a lot of stuff that's happening underneath it. Even if we're just thinking with the simple light metaphor, there's a wire going to a tree, but like we're talking and thinking about the entire tree. There are a number of experiences, ideas, and like tissue realities that are going to inform how your pain gets presented. The pain signal is one that is fundamentally prioritized by the brain. So if your brain thinks that pain is the most important thing for you to be feeling in that moment, you are going to feel pain. But if you are under imminent danger or some kind of other threat, even though your tissue will be sending the same quality of signal, even though your brain will be aware that this pain signal could be something that it is causing you to feel. If you are worried that your child is in danger, if you are worried about work stress, if you have other more imminent threats to your well-being, pain isn't going to be a high priority for your brain, and so it's not going to send that signal along. We know from extensive research that understanding pain and what it is and what it's telling you makes you better at managing it. And we know that fundamentally, it's a normal, healthy process that can be altered by diseases, It can be altered by the way that we think about it, and it can be altered by the entirety of our experience. So I said this to Saturday earlier, Shirley, but if you have any questions, please feel free to raise your hand. These sorts of webinars work best when people interrupt as often as they feel the need. So if you feel the need, please chime in. So at any one time on the planet, 20% of people have been experiencing pain for more than 3 months. The lifetime prevalence of this is really high. And because we know that so many people have pain that doesn't match their physical realities, workshops like this end up being really important. So there is an idea in Western thought that the body and mind are separate. I think, therefore I am for René Descartes, and we should immediately forget about him. He is 400 years old, and he has been wrong for about as long as he had this idea. The mind and body are not separate in any stretch of the imagination. Your brain is intimately connected with what's going on in your tissues. And your brain is really complex when it comes to how it thinks about your body. It has multiple maps of where things are, how they're moving, and how they might move better. And those maps are connected to the way you feel and the way that you think and your emotions. And the deep interconnectedness of this means that thinking about it as a single issue is, or rather as two things that are disconnected, tends to be a very ineffective strategy when it comes to understanding what is happening in the system. So, because we are social creatures, it helps to recognize that pain is a social tool. It ends up being a teaching tool for society. It's useful in that if I watch you do something that causes you pain, it can tell me that I need to avoid that thing. It's useful as a group to help us identify things that are dangerous to our body. It's useful in terms of communication. Like, it is a way of letting other members in our group know that we need care, attention, understanding. We describe emotional states as being painful, like grief and loneliness and alienation and loss. And we need the people around us and the stories that we collectively tell to interpret and contextualize our experiences and to figure out what we need to do about it. You running to your mom when you've skinned your knee for the first time and getting a Band-Aid is an important teaching tool. And it's one of those things that without having it, we would end up being in the place that we are. And through this context and through this understanding, we've talked that pain as a warning signal and your brain being the main decider on whether or not the thing you're feeling is a threat. Well, our social understanding of what this pain is heavily informs whether or not we think that this painful thing is actually threatening. I want to talk about a couple of examples of things that should be painful and then things that shouldn't. Like, you would think that being shot would be a jarring experience that would stop you from being able to do anything. But Reagan was giving a speech while he was shot and he didn't notice. They had to tell him that he was shot and he was surprised. Soldiers with war wounds, they can lose limbs, they can be terribly maimed and not feel a tremendous amount of pain during the experience or afterwards, because their brains have prioritized the other elements of their safety over the thing that is happening to their limb. Surfers who experience shark attacks can lose entire limbs and they will report that that thing felt like a bump. Like, they don't talk about how incredibly painful it is. They're like, I felt a bump and didn't recognize that my leg was gone until I looked at it. If you imagine a football team celebrating at the end of scoring a massive touchdown, like, you got a team of, I guess, 36 people, and they're all completely massive, and someone scores a game-winning touchdown, and the entire team jumps on top of that individual. That's easily 1 ton to 2 tons of collective football players spread out over this one person. And they pop up afterwards, and they're fine, and they're happy. If you can imagine that same football team jumping on top of someone on the middle of Bloor Street for no reason, there would be a lawsuit. That person would go to the hospital. Like the context in which people are experiencing these things matter. In my practice, I have a lot of people coming to me who have pain. Excuse me. I have been talking a lot today. Who have pain that they think is because of a disc bulge or because of a degenerative disc in their low back. I can tell you from imaging studies that there are lots of people who have disc bulges in their low back, and even more people who have degenerative discs who have zero pain. And so when we know that this physical thing is there, and we know that it is related to pain in some people, but not others, it makes us really curious about why the people who have the pain are having the pain, and whether it's the disc bulge that is the cause. So we've talked about gunshots and war wounds and football teams jumping on top of people. And I can tell you that like the paper cut that I got this morning is by far more painful than all those things. I have been thinking about it all day. I think about it every time I sanitize my hands. It is a constant reminder that I have cut my hand and that I need to take better care. So it is important to think that context really matters and threat really matters. So the same minor injury, like a finger injury in a concert violinist, will cause more pain than it will in a professional dancer, because that concert violinist uses their hands for a living. They use their hands for their art. They use their hands for their passion. They're going to feel that pain. They're going to worry about that pain in the way that a professional dancer just won't. The professional dancer doesn't need that finger. They can tape it up and move along. But that concert violinist, that finger is critical. And that pain could maybe mean that they're getting retired, or it could maybe mean that they have to stop earning money, or it could maybe mean that they have to find a job that they hate. So in this way, I'm hoping that I'm illustrating that the perceived amount of threat to your entire being is what heavily influences your perception of what is painful and what is not. So it's super useful to think about. So you have this pain signal that is in your brain. And there are things that can be already there in your brain that make you feel like that pain is worse. So if you are generally stressed, say you are stressed about work, your body is already in a place where it is going to be sensitive to work-related pain signals. If I have a pimple on my face and I am going to prom, that pimple is going to feel red and hot and heavy, and I'm going to have an almost irresistible urge to touch my face, versus if I had a pimple in the middle of the week and I didn't need to see anyone. We know that if there is a perceived cause of pain that is dangerous or threatening, that people are going to feel more pain because of it. So when we look at patients who've had breast cancer, who've had either lumpectomies or mastectomies, so they've either removed part or all of their breast tissue, if they feel like their post-surgical pain is because of the surgery, they are much less distressed by the pain and have less pain than people who think that their residual pain is from the cancer itself. When pain is unexplained, ongoing, or unpredictable, it can really flare up our perception of what's happening in response to the pain. And just like there can be ignition cues, like things that sensitize us to understanding whether or not we're going to have pain, there can also be things that kind of turn that volume down. The classic example is the toothache that you go see a dentist for, and the second you get into the dentist's surgical chair, your pain is almost gone. Or in my particular case, people regularly come see me because they have pain, and by the time they come into my office, their pain is better. It's not because the biological process that's going on in the area has changed in a meaningful way. It's that their brain is satisfied that they have done the thing to address the danger. So just like you are satisfied going to the dentist to feel better, and your body knows that it's going to take care of that tooth pain. Similarly, when people come see me because of their neck or shoulder pain, their body knows that they're doing something to take care of it. And what the pain signal was there to do was communicate that something needed to be done. So we know that age, gender, and culture all play a massive role in influencing how much pain people have. As a general rule, people under the age of 60 report more pain than people over the age of 60. You can imagine a baby being hurt or a baby engaging in a situation that has led them to have a damage or alarm signal, looking towards their parents to figure out whether or not they should cry, whether or not they should be in distress. We've done studies where we measure the amount of pain that heterosexual men are facing, and they experience less pain or report experiencing less pain when females are present. And similarly, if we look at pain perception with regards to hospitalization, we notice that women by and large tend to be medicated less than men do by weight and all of the other variables that are important for the same amount of pain. And we have a major deficit in the research when it comes to understanding women's pain. Most of the research has been done on men. It's been done on male animals, and it's been done by male researchers. And there are reasons behind this, but none of them are particularly good. And so we actually don't understand women's pain as well, and we know that we don't respond to it in as meaningful of a way, which I think is kind of a dark mark on the way that we as evidence-based professionals have been trying to deal with pain. We also know that culture informs what might be painful. So we know that there are ritualistic ceremonies in the Philippines where people will get crucified for Easter, or rather for the wind up to Easter for the Good Friday parades. And they don't report being in a terrible amount of pain, even though they've literally been crucified. We know that there are people who regularly engage in demonstrations where they hang themselves up by hooks that go through their skin. They don't seem to be in a tremendous amount of pain. And even the way that we express pain in between each other has changed quite drastically between cultures. If you go to a Chinese maternity ward, they are by and large pretty quiet. If you go to an Italian maternity ward, they are by and large pretty loud. We have cultural differences that are expressed kind of almost by way of invisible norms that just kind of let us know how we are supposed to display our pain, when we are allowed to display our pain, and what sort of social utility we get out of being vulnerable in that way. What I hope you're getting from all of this is that the thing that you are experiencing when you are experiencing your pain is deeply and truly unique to you. It is melded by your life experience. It is melded by your experience with your parents. It has been changed by your experience with life. It is based on whether or not your brain feels like there is a threat. But it's very personal. And even in the best case of scenarios, as a professional who's been working for over a decade, like, I can't know your pain in the same way that you can. You are the expert, you're the PhD, you have all of the things. What my role ends up being in these situations is trying to help you understand the thing better. So that's the first bit. That's the preamble. Pain is a warning system. It is a complicated warning system. It is dependent on our life experience and our understanding of the world. So I want to dive into the anatomy a little bit and kind of talk about what is happening at each part of your body as the pain moves its way up. So your nerves, in the context of pain, act like the alarm system. There are 3 different types. They test for pressure, they test for chemicals, and they test for temperature. And that's kind of it. Like, there are several ways that they do test for pressure and temperature and chemical composition, but all of those don't really mean very much in terms of our understanding of the thing. If they receive enough stimulus to send a signal, they're going to send one signal. And so usually what that means is, like, if I have a tiny little pin and I stick it into my hand and it causes the 10 pressure sensors around the area to be like, danger, warning, there is something sharp in here and there should not be something sharp in here. Then those 10 signals are going to send something up. And if I use something bigger like a nail, well, maybe now there's 100 or 1,000 that are sending that same thing. So in a way, there's kind of a one-to-one. Like if one of the things gets stimulated, it's going to send one signal up, and it can only send one signal at a time. It's either sending a signal or it's not sending a signal. There's no like halfway, there's no middle ground. It's either going or it's not. These nerve fibers are really adaptable. And they're there for a reason. They only live a few days before being replaced. Normally your body is kind of like constantly turning them over. But when you're injured, in the immediate aftermath of an injury, especially when your body needs to know like exactly what's going on and exactly what kind of local tissue irritation there might be, it's actually going to send more. So if you've had pain for the first couple of days or for a long time, you actually have more sensors in the area that are telling you whether or not that area is hurt. It's like a local sensitization reaction. This can sound a little scary, but the good news is that it remodels every 4 days, so there's plenty of time for it to change back into something that is less sensitive. And that is something that should kind of naturally happen as you start to move and as that injury process starts to end. All of these signals are like whether or not these nerves grow in the area is influenced by messaging from your spinal cord and also messaging from your stress response. So if you have a lot of adrenaline or cortisol, which are kind of stress hormones that are primary responses to stress, you will get more pain, or rather not pain, but damage sensing alarm systems in the area that was previously injured. But even if I put the pin in my hand and 10 of these local signals have decided that they are going to send this message up to the spinal cord, the activation of the system isn't sufficient for me to feel pain, and it's not necessary for me to feel pain. These signals can be sending no signal at all, and I can still have a pain experience. So, sorry, one sec. Allergies are brutal right now. So there isn't really like a pain pathway. There's a danger pathway. There's like a threat detection system, but it's not pain or anywhere close to pain yet. So you have this danger signal from my hand that has reached my spinal cord. My spinal cord now is going to do a little bit of sorting, and it's going to try to understand what's happening at the level of my hand in the context of what's happening in all of the tissue that one spinal cord level is going to tell us about. So like, let's say that I have shoulder discomfort. That's going to go to the same part of my neck that covers like most of the shoulder and a little bit of the front of my chest. And that's going to be like the total constellation of what is happening there is going to inform whether or not my shoulder perceives that this thing is a threat. Because remember, pain isn't the only single signal that's going up to the brain. There are signals from my muscles and from my joints and from my skin, and they're all really interested in telling the brain all of the data from the world around me and all of the data from the world inside me. And so if my spinal cord is getting a small, like, damage signal, but there is a very rich variety of other signals from my external world, it's not going to send that pain signal up to the brain. It's going to be like, this probably isn't important. But if we get enough like damage signaling to inform the spine that that damage signal is a priority, it will send that signal up to the brain. And we know that in both the short and mid-term, the spine will send more pain signals to the brain for an area that we know is damaged. And much like stress hormones will attenuate how much nerve supply you're actually, or rather how many nerves are in an area to detect for problems, it will also change the way that the spinal cord behaves with regards to pain. And so if you have a spinal cord that's sensitized, it's more likely to send signals up to the brain. And very much like the peripheral, what's happening in the nerves in your skin and in the place that you have pain, it's very reversible. Like the change that your body makes to accommodate for sensitizing you to longer term pain is just as reversible at the spine as it is in the arm or wherever it is that you have pain. So you can kind of imagine that as you go through time, and say you're like at 2 weeks, 4 weeks, 6 weeks, 8 weeks, 3 months, the amount of local tissue damage that has healed and scarred and remodeled and become like the useful functional tissue that we hope it would be, the amount of pain that you get from the tissues is going to start dropping off quite significantly. So if you're still having pain at that point where like the disease process should be mostly completed, then most of the pain that you're having because your local tissue is upregulating the amount of pain that is, or rather the amount of distress that it is trying to perceive. And your spinal cord is sending these damage and distress signals to the brain more frequently. And also the brain is interpreting these signals as progressively more and more threatening and distressing. So you have this signal that has come from the hands where there has been pressure or temperature or chemistry that has let the body know that there might be a threat. The signal has reached the spinal cord, which has decided that in the context of everything that is happening to the area that area of the spinal cord is responsible for, that the brain needs to know about it. The signal has now reached your brain. And at the brain, you need to figure out, based on context, what you're doing and what you're feeling, what this signal actually means. If your brain thinks you're in danger and that you need to take action about the thing that is happening, that is when you feel pain. And in that moment, your brain is activating your body to protect you. It's turning on the part of your nervous system that makes you stressed and afraid and scared, that makes your heart pump and makes blood go to all of your vessels and might make you sweat a little bit and makes you feel like anxious and distressed. It's going to activate your motor system, get you to tense up, get you to pull away from the thing that is painful, get you ready to run, fight, flee, like get out of the thing that is going to harm you. It's going to take your endocrine system, the part of your body that deals with getting you energetically ready for you to do the things that you need to do. And it's going to get you energetically spun up and ready to fight whatever it is you need to do to like get this thing to feel better. It's going to tap into your ability to produce pain. Like if you aren't responding in a way that your brain in its wisdom thinks is timely and appropriate, it's going to crank up the volume on that signal till you pay attention to it and do what you need to do. Like the classical example of this for me is shoulder discomfort. Anyone who works in an office has had it. I've been typing for a long time and my shoulder started to ache. And that ache is probably just a combination of signals that tells me that lactic acid is built up in my shoulder and that I probably need to move to make it feel better. But I don't move it because I have a deadline that I have to work on. And I don't have time to like step away from my desk and work on the thing. So I'm just going to keep on typing away until the pain becomes so bad that I have to pay attention to it. This is your body just turning the dial, being like, hey, this thing could be damaged. Like you need to know about this threat. You need to respond to this in a meaningful way. Like it's time, let's go. Fine, I'll yell. And when you yell, like you kind of have to pay attention. And it would be nice if you didn't, but there we are. Your immune system is going to start to respond. If there's local inflammation that's needed at the area to promote healing, great. If there's a wound that your body needs to make sure it doesn't have any bacteria or virus or nasties in it, then your body is going to be responding in that way. And that is heavily linked to what your brain is doing. And finally, as you recover And this is sort of like long after the initial threat has passed. Your body knows that it needs to restore its fuel supplies. So it's going to get you ready to eat and rest and digest your food and come back down into a normal space. And what we're hoping for is like for this loop to end at this point. Like we want you to be able to rest. And we know with chronic pain that doesn't. So it's useful to think about all these systems together as sort of like a brain orchestra or a brain symphony. And in a normal, healthy, functioning brain, the orchestra is always playing different tunes. It's always trying new things. It's iterating, it's exploring. It feels like it has the confidence to like try something and be okay if it doesn't work. But when people have chronic pain, they're kind of playing the same tune over and over. This thing is dangerous. We need to worry about it. It's a threat to us. We don't really know how to move it. And so the orchestra starts just playing the same song. It doesn't start trying to learn new tunes. It doesn't feel like it can be creative or interested. It can't seek new challenges. Musicians start to quit. So now you have the person who should be playing the timpani, playing the violin. So they're not very good anymore. And it gets to the point where this pain experience can literally dominate every aspect of your life, which is desirable for us to avoid as best we can. So there are a couple of conscious thought patterns that I think are really useful to call out in the context of understanding pain. Because these are the sorts of things that lead to the orchestra playing the same tune over and over again. And they're sort of like this, like, I'm in pain, so something bad is happening to my body. Like, I'm not safe, I'm not well. My pain is bad enough that I'm going to stay home. I'm not going to go out. I'm going to keep quiet. I'm not going to like talk to the people who are in my life. I'm not going to engage in the world. I need to stay in until this pain goes away. If the best scans in the world can't find this pain, like I've had an x-ray, I've had an MRI, I've seen all of these professionals, and none of them can tell me what my pain is, my pain must be terrible. Like the source of the threat must be terrible. Though why can't someone just fix this for me? Is brutal, because as you'll kind of see further in the presentation, like we need to feel like we have agency to change the thing for it to change in a meaningful way. Like, I'm frightened of the pain, so I'm not going to do anything. Or I'm going to wait till my pain gets better before I try to do things. All of these are like traps that get you stuck in that same orchestra playing the same tune place. And there are a couple of things that we can do to get a sense of whether or not you're experiencing a more sensitized form of pain. So we sort of talked about how your brain interpreting the threat is the thing that causes you pain. So if your brain is more inclined to interpret things as a threat, well, that's going to make your pain experience worse, and that's going to make your pain feel less controllable. If your spinal cord is more inclined to send distress signals up to the brain, that is going to make it easier for the brain to see those signals. And similarly, what's happening in the, like, at the end point where the pain is, can make it feel worse. And so if we're noticing the things I'm about to discuss, it gives us a really good sense that like part of the system has been playing up what is happening with pain. So like the pain sticks around even though healing should have happened a long time ago. The pain spreads. So at first you had pain that was just like right on the tendon, but now your entire shoulder hurts. The pain worsens. Like this pain that should be getting better, because like that's what healing tissues do, they get better, has now started to get worse. You start to notice that more and more movements start to feel really uncomfortable. You start to notice that your pain is less predictable, and you can't put your finger on why your low back hurts today and it didn't hurt yesterday. You start to think about your pain a lot. And this one's really hard to notice, but like if you're constantly telling yourself a story about your pain, like, oh, I'm going to have pain, so I can't go to work tomorrow, or, oh, I'm going to have pain, so I need to watch what I'm doing, or, oh, like, maybe I'm not going to be able to do this thing, or maybe this means that I'm not going to be well enough to attend my niece's graduation, or whatever version of that there is. If you're engaging in narrative and emotional function about the thing that you're experiencing, that tells us that your brain has identified that it's a really big threat and that it is very interested in making sure that it's controlling for that threat, which is what's causing you to have more pain. And it's especially bad when the pain experience that you're having is linked to other threats in your life. Like if you're worried about job loss or an old injury that might have never fully healed, or you're worried that it's going to affect your career or livelihood going forward. All of these things are going to amplify your pain experience, and they are important things for us to work on in order to make things better. But the good news is that we're finally to the part of this talk where we're going to talk about making things better. So when it comes to pain, and it comes to pain that you've had for more than 6 months, here is the general rule set. 1, people with chronic pain need, with a capital need, thorough examination. It's really important that we make sure that something that could be actually seriously wrong with you isn't wrong with you. And really, a good history physical diagnosis might involve tests, it might not involve tests. It definitely involves a good conversation. It definitely involves you feeling like the healthcare professional has a good understanding of what's happening with you. And it should also lead to you having a good understanding of what's happening to yourself. You really need to make sure that the care or the strategy that's being prescribed makes sense to you and to your understanding of the problem. It is perfectly appropriate for you to ask if there are scientific studies that support what the professional is saying. It is a very good idea to make sure that you really, truly have a grounded understanding of why that care is being proposed and why that person thinks that it will help you. You need to make sure that you have every single one of your questions answered in a way that is satisfying to you. That might mean that you're spending a long time talking, and that is just fine. You got to make sure that you understand what is going on, because you can't be a better expert in your own management if you don't understand the thing that you're experiencing. You should not be dependent on any one healthcare professional. We are here hopefully to be experts. We are here to help you understand your body better. We are here to enhance your own expertise in your experience. And we're here to provide good, meaningful strategies and help you set good goals. There isn't a therapy or a pill or a magic bullet that is going to do the thing. Even if you try it and it feels good in the short term, it's not going to be the thing that addresses the problem in the long term. When you've had pain for more than 3 months, you need to be in the driver's seat. And any healthcare professional that takes you out of the driver's seat because they're so fancy that they can do the thing for you isn't doing you any good. You need to be with someone who's willing to push you, ask you to take accountability, and to help you move through this thing in a way that feels intelligent and grounded and strategic and safe. Because again, this is a danger signal. We're not going to beat the danger signal by doing something that doesn't feel undangerous. It's really important that you set goals that are understood by both you and your professional. These should be measurable goals. They should be achievable goals. They should be multidimensional, because pain affects your life in multiple dimensions. So you should have physical goals and social goals and work-related goals. And all of those goals and all of those measurements are actually a lot more important in terms of measuring your progress than what your subjective day-to-day pain is. So you're looking for someone who is compassionate, enthusiastic, and informed. They should be curious about new ideas. They should be experts, and their primary goal should be helping you master the thing that you're experiencing. So one of the things that we know is the hallmark of people with chronic pain who don't get better is what we call fear avoidant behaviors, which is basically to say that there are people who have gotten to the place where they don't want to move because they're worried that their pain will get worse. And so addressing that ends up being a big part of my practice, like figuring out how to move people in a way that feels safe, and building that forward is the foundation upon which chronic pain resolution is built. That was an awkward sentence, but that's okay. So by the time people have come to see me, they have usually developed a couple of different strategies for managing their pain. And I think for understanding, it's super useful to break them up into active strategies and passive strategies. And then we can further break them up into like pain focused or movement focused. So passive strategies are sort of the things that you don't have to do anything for. So avoiding pain-provoking or possibly pain-provoking activity, doing nothing, resting, waiting for something to change, or waiting for someone or some medication or some therapy to change it. In some contexts, like this is a learned behavior. There are problems, and most problems, that will go away if you just leave them alone. Like the classic, I hurt a muscle while I was going for a run. Rest is a perfectly appropriate thing to deal with this. And you've learned this strategy from the experiences that you've had. Like these aren't inherently bad, but by the time you have had pain for 3 months or more, they are going to be less helpful in getting you better than the active strategies. And the active strategies are simple. Well, not simple, but they're accessible. Seeking a better understanding of your problem is sort of foundational. Exploring different ways to move and to do things. So if you notice that it hurts you to do a thing one way, feeling like you have enough creativity and safety to try and do things another way to see if that feels better. If it hurts to do it with your arm up here, maybe it doesn't hurt to do it with your arm in close. Nudging the very edge of your pain. And so we talk about this a lot in terms of how to move people forward as we're starting to move. And there is a version of almost like over-egging the custard, where you have people who have pain who just go at the pain over and over and over again. They're like, no, I'm going to train through it. Like, no pain, no gain, go really hard. And that doesn't work well for a lot of people who have chronic pain. Like you end up getting pushed back, you end up getting tired. And so I'm not talking about going like into the pace where you have pain. I'm talking about kind of in a grounded, mindful way, thinking, oh, I walked 20 minutes a day last week. I wonder if I can walk 22 minutes a day this week. And going into that with a level of curiosity and being like, was 22 minutes good? Oh, turns out it was. Great. Well, I'm going to walk 22 minutes a day for the rest of the week. And then maybe next week I'll try 23 to 24 minutes and see what happens there. This curiosity around the edge of your pain, not so much the like, is it there? Is it there? Is it there? But kind of like gradedly checking ends up getting people through chronic pain places faster. Staying positive is an active strategy. Making small attainable goals and working towards them. And once your small attainable goals work out, setting your bigger, longer term goals and working towards them and being patient, understanding that they're going to take some time to bear fruition. We can also talk about kind of movement-focused strategies versus pain-focused strategies. So pain-focused strategies are kind of like the active things that you do. They're generally speaking pretty active, although the literature can get really thorny when they discuss it. But a pain-focused strategy is something that you're doing in direct response to the thing that you're experiencing in order to stop experiencing that thing as soon as possible. For emotional pain, this could be having a couple of drinks. For physical pain, this could be taking medication in a big dose. This could be doing a lot of like super heavy self-massage. It can even be like, I would say that seeing a professional like me can be a pain-focused strategy. Like if I am being a responsible professional, one of the things that I am constantly looking out for is whether or not people are using me in the way that I would like to be used, which is to make their transition between being a person who has chronic pain into being a person who doesn't have chronic pain more comfortable, while providing them the knowledge and resources that they need in order to get better. And then there are movement focused strategies, which are basically like, if we understand pain as your body needing to learn that it can move safely so that it stops sending the damage signal, then movement focused strategies are exactly that. They can be super simple, they can be super gentle, and they might be something as like genteel as, instead of me hammering on my shoulder as hard as I can to get a super deep tissue massage, well, maybe I'm just going to move my neck back and forth, because really what my shoulders are telling me is that they want to move. So I'm going to lift them and lower them, and I'm going to move my head back and forth. And I'm not going to try to feel like a very big stretch, because I'm not trying to make the pain go away. I'm just trying to listen to the signal that my body's giving me. And I notice after doing that for a couple of weeks that, yeah, my shoulder does feel a lot better, and I didn't have to hammer on it and cause more inflammation and more pressure and make it worse. Making the transition between being passive and pain focused and being active and movement focused is difficult. And it's kind of impossible to do unless you have an understanding of what's going on with you. Like, if you are worried about the thing that you're experiencing, you're not going to make this leap in a meaningful way. So building an understanding with the healthcare professional that you're working with is the foundational piece that's going to let this thing go farther. It's also really important for you to build coping skills. And there's a number of ways that you can go about this. There's like cognitive behavioral therapy that you can do with a psychotherapist or social worker. There's acceptance and commitment therapy. There are coping skills trainings that are available to people in the community. And then there's mindfulness and mindfulness-based approaches. And all of these can be really helpful in helping you have a more grounded sense of where your body is, what your pain is meaning, and what you can do to move forward. So we've kind of already addressed the normal pain kind of approaches, where for the most part, people are either engaging in just avoiding the pain, or they're engaging in boom and bust. And I'm going to share a screen with everybody. And okay, there we go. Let's make this graph real big. All right. So you can kind of see at the top of the screen, this is the graph of what happens when people normally avoid pain. There is an initial onset of them not feeling super comfortable with the thing that they're experiencing, like they've had a pain experience, and then they'll rest, and then they'll try again, and they'll hurt it again, and then they'll rest. And this will kind of keep going on with their tolerance lowering sequentially as they kind of go through the experience. The classic example that I see of this is the person who likes to lift weights and who has a shoulder injury. Usually these shoulder injuries are tendon problems. Tendons need regular load in order to be able to heal. And so they'll stop being irritated if you take 2 weeks off of them. But when you start training again, they'll start to hurt pretty quickly. And so you'll see that these people will become irritated sooner and sooner and become more and more sore. And you can see the same thing can happen when people go at pain too hard right off the bat. You have this pain experience and you're like, no, I'm going to work through it. And then the pain gets bigger and bigger and bigger because your brain is telling you, hey, this is wrong. Like, I'm not okay. We need to make this thing work better, until the pain becomes so much that it's unbearable, which causes you to become incapacitated. And you're usually in quite a bit of pain at this state, until you start feeling a little bit better, and then you're gung-ho and charging at the pain again. With the same thing, eventually you will become less and less able to stop this pain experience, because you're not building resilience in the sense of, like, I guess you're building will and grit and all that useful stuff, but you're not telling your nervous system that this thing is any less of a threat. And so your nervous system, trying to protect you, doing its best, is going to keep giving you that pain signal so that you respond to it in an appropriate way. So I'm going to catch up with where I was. So we know that the no pain, no gain kind of leads to a boom and bust cycle. Like you'll be functioning better for a while, but then eventually your tolerance will exhaust. We know that using let pain be your guide is sort of a way to avoid the pain, potentially. I think what I'm describing could also be framed as let pain be your guide, but I think will be really general. The thing that's going to work, and the thing that we know works well when we give it to people who have chronic pain, is trying to understand what your pain means and responding accordingly. And in that, you're kind of understanding a couple of things. One, it means that you're understanding that when you experience pain, it doesn't necessarily mean that you're damaging your tissues. If you know that your pain has existed for longer than it takes the tissue to heal, then there is a sense that, you know, you might be being overprotective with those tissues, and that your brain might be being overprotective with those tissues. That when you hurt yourself, you haven't necessarily harmed yourself. And like all this stuff is true. And I'm talking about this like from the end user perspective, that now that I've recognized that this pain is an amplified signal, I can just charge right at it. And that's really not the case. Like, even though the conscious part of your nervous system is now doing a better job of being curious about the threat that the entirety of your brain is perceiving, your nervous system is still trying to protect you. So it's only going to let you increase the amount of movement that you're doing and increase the amount of load that you're putting through it gradually. So got a little quiz, or not quiz, exercise that you can do the next time that you feel pain. So you're in the space, you have experienced pain, and you're going to stop and you're going to step away from the thing that you're doing. And I want you to think about it. I want you to think about what you know about the pain. I want you to think about what might have activated the alarm. I want you to think about what cues in your environment might have caused you to ignite that pain. And I want you to maybe try to get to know what the pain is from a place where you're not quite so panicked and you're not so desperate to have it gone. Like, I think, especially with chronic pain, I want to get away from it just as quick as I can all the time. It's a threat signal. I want to, like, this isn't safe here. I don't want to be here. I want this to be gone. This is a terrible thing, and I just want it to be over. And there's something useful and maybe powerful about approaching the thing and being like, hey, I know why you're here. And I respect why you're here. Like, you're here to tell me something. You belong here. You deserve to be here. You are part of my experience. I don't need you to go away. I am grateful for the thing that you are trying to teach me. Let me try to be a better student. Like, what is the alarm that we're detecting? What is the thing that I need to do better at? How do we move forward and not make the signal go away, but make the signal not need to happen? And the answer to this is that we pace ourselves and that we slowly add exposure to the thing in a way that doesn't cause us to feel worse. Manual therapists usually have this saying, motion is lotion. It's a great line, like great rhyme. I hate it, but it's kind of true. Like, as we start to move, movement is kind of the foundational thing that your brain needs to know that it can move safely. So as we're starting to think about how we want to expose our body to the things that are going to make us not have pain anymore, it's a really good idea to pick what you want to do. Like, if you want to be able to dance, if you want to be able to run, if you want to be able to walk, if you want to be able to go on amusement rides with your partner, amusement park rides, rather. Amusement rides sounds so much worse. And I think it's really important to, like, consider what you need to do as well. Like, if you have pain and you know that you need to lift up your kids every day, Well, then focusing on tasks that'll help you lift up your kids might be the thing that you want to start working on first before you start working on the things that you want to do. It's really useful to find out what your baseline is. And I think there's like a really great exercise from figuring out what that might be. And the great thing about this is that like there isn't a perfect version of this. Like you can do this exercise and be wrong, and that's going to help you calibrate the exercise itself so that the next time you do it, you have a better chance of being right. And so let's say we're talking about someone who is trying to figure out how long they can walk every day because they want to walk every day. So we'll ask them if they can walk 15 kilometers. And they'll be like, I am positive that I would hurt like within 12 kilometers, and I know I'd really hurt the next day. And we're like, okay, what about 10 kilometers? Well, I don't think I'd hurt the day of, but I think I'd still pay for it the next day. Okay, well, what about 8 kilometers? No, I might hurt, I might not, like I'm not super sure. What about 6? No, I can definitely do 6 without having pain. 7? Maybe. So it's 6. And you do this exercise to figure out what our potential safe zone is. And what we want to do is figure out what that is. So we'll choose that 6 kilometers walk every day for a week. And we'll see if we're right. And if we're right, that person is going to be able to walk every day and not have an increase in pain. And if we're not right, we're going to have to dial it down a little bit to make sure that they're still pain-free. Once we've established a baseline, then we can plan our progression. And generally speaking, people tend to progress too fast. Like people get a little big for their britches and try to like dial up really quickly. And for this, it's not necessarily a bad thing to do, but it is a good thing to recognize immediately as soon as it happens and then adjust and respond accordingly. 20% weekly volume is sort of a good safe rule, or at least relatively safe rule in runners. But the truth of this is you're going to learn this as you go along. You might be able to increase more, you might be able to increase less, but your fundamental goal should be that you don't flare up your discomfort. And if you do flare up your discomfort, you don't want to freak out. Like, okay, I went too hard. Good to know. I can't dial up by 20% this week, but it's okay. I can still keep on doing this thing. Like that I have failed at this thing doesn't mean that I failed at the process. It just means that I need to go a little more slowly. This is sort of a lifestyle thing. You'll need to plan more. You'll need to put more time into your life to like make these things happen. And it'll really help if you seek happy activities with happy people and do things that you like. Like if you like walking, then walk with a friend. I mean, mask, socially distance, like do whatever you got to do, but like find things that you enjoy doing with people that you enjoy doing them with, and make those things your goals and your targets, because it'll make it a lot easier for you to do it in the long term. And so in this way, you can kind of imagine, like, as we listen to what your body has to say with regards to the signal that it's giving you, in that your nervous system still doesn't trust that you're going to be able to do this activity. And we're just slowly bumping up how much you can do over time until you can do, hopefully, all the things that you want to do without experiencing discomfort. It's also really helpful because we know that this pain thing is primarily happening in the brain. It's also really helpful to use our brains to help us feel better. So if you know that, say, bending forward is going to hurt your back, instead of bending forward at the start, you can just imagine bending forward. Even just the act of like going through the motions is going to make your brain more comfortable with the idea that this thing can happen without you having pain. As you are trying to do the things, you can change your positions and add variety. Like maybe it doesn't feel good to bend forward when you're sitting in a chair, but maybe it feels okay to bend forward when you're standing up. Maybe you can pull your hips towards your head while you're on the floor, but maybe you can't pull your heads towards your hips. You can really, in a place where you feel comfortable and safe, add a lot of variety to this thing to actually challenge like what things are going to make you hurt and what things aren't. You can add balance challenges. You can stand on a pillow while you do this. If you have a wobble board or something similar, you can do the thing that you thought would have been uncomfortable on one leg and just do it less. You can make your visual inputs different. You can do things with your eyes open and closed, looking at the ceiling, looking at the wall. You can alter the environment where you're doing your activities in. At first, you might be doing them just in your home, but then you can go out and do them at the park, and then you can go out and do them in a pool. You can try to move as much as you can as you experience different things. Move around while you're watching a comedy show. Move around while you have a sad drama in the background. You can add distractions so that your brain has different things to think about. You can have art or music, or you can try to meditate as you're moving. You can plan activities that are going to be fun, but also work towards the task that you're trying to do. For people who have a hard time picking things up, like going and playing with your kids at the park, playing catch, can be a great way to like get down to ground level and back up as a way to challenge yourself in a small way. I am seeing my screen flashing. Oh, thanks, Shirley. Have a great night. You can break down the movements into different functional movements. So you can, like if we know that bending forward is something that your low back hurts to do, well, we can teach you how to bend your knees better. And then we can teach you how to move your hips better. And then we can teach you how to move your upper back better. And then finally, once all of those things are working in concert, we can then teach your low back how to move better. Like we can break up the motion so that your body gets used to performing the task without necessarily doing the thing that's irritating. We can make sure that the neighboring tissues are in a friendlier state. So making sure that we're relatively relaxed, making sure that we're comfortable. I know for a lot of patients who have neck pain, one of the things that I can do to help them move a lot more comfortably and more easily is I'll just make sure that their shoulders are supported so that there doesn't have to be all that tissue drag down on the structures of the neck so that they can turn their head freely without having things. Similarly, if I have a hard time turning my head left to right, what I might do is stare at an object in the distance and swivel my chair underneath me, as opposed to turning my head left and right. And I'll notice that I can probably do that without the same kind of pain, because even though my neck is turning, I'm producing the movement from a different place. It ends up being super helpful to play with your glitches. Glitches are a very cute term for all of the things that we do to support when we have pain. So people with shoulder injuries will frequently like lift up their shoulder before they lift their arm. People with low back injuries or hip injuries will put their hands on their knees before they stand up. And these behaviors are things that we learn or we think are going to be helpful, but they aren't always helpful and they aren't always necessary. And they are part of sending a signal to our brain telling us that these areas are sensitized. And so the more we can play around with not using them, usually the faster we get better. And then the final thing you can do is just get curious. Like if you are coming at it from a place of safety and creativity, being able to walk in and challenge these things can make a really big difference to how much pain you're experiencing. So to do the 1 minute recap, and thank you for staying late. The 1 minute recap is pain isn't happening in your body, it's happening in your brain. And there are a bunch of ways that that pain signal can get turned up. And the way that we try to turn it down is by finding ways that you can move comfortably and safely, and doing those over time, slowly increasing them until you're able to do all of the movements that you want to do without experiencing the discomfort that you're experiencing. I'm happy to stick around for a couple of minutes if anyone has any questions. I want to thank you for your time and attention. If you have any thoughts or concerns, please feel free to reach out. And if you want a copy of this thing, I can send you a video if you want to leave a link in the chat.